Hopefully third time is a charm, but my name is Ella Gibson, and this is my presentation, Cold, Calculated, or Misunderstood, Rethinking the Psychopath Stereotype. Talk psycho to me, defining the disorder. Psychopathy is a clinical construct used to describe a personality disorder with a grouping of traits and behaviors. These traits and behaviors include a lack of empathy, remorselessness, impulsivity, manipulation, and emotional detachment. A psychopath is an individual who presents a specific set of traits and behaviors and scores a 30 or higher on the PCLR. The PCLR is the only assessment that has been approved to diagnose psychopathy. The assessment relies heavily on files and recommends that you do an in-person interview to diagnose. Files are those the history of one, anything one can get their hands on, like school, if they had any disciplinary actions like suspension, expulsion, or it could even be like doctor visits if they had ever been diagnosed with anything, what medications they were on. Psychopathology is the scientific study of mental disorders, including symptoms, behaviors, and treatments. Psychopathology also explores other psychological conditions from anxiety and depression to personality disorders and psychosis. Psychopathology is also used to describe the actual presence of disordered thoughts, emotions, or behaviors in a person. Psychopathic is a descriptor often used for a person or behavior that shows tendencies associated with sociopathy. It is also important to note that psychopaths do know the difference between right and wrong. Who is who in the DSM zoo? Psychopathy is often mistaken or interchangeably used with psychotic, insane, narcissism, or sociopath. It's important to note that although these disorders can be confused, they do have key differences. Psychotic or psychosis is a mental condition in which a person loses touch with reality. Psychosis typically involves delusions, hallucinations, disorganized thinking, bizarre behavior, or even a lack of awareness of the condition itself. Psychosis can occur in conditions like bipolar disorder, schizophrenia, or severe depression. And psychosis can also be due to substance use, or brain injury. Insane or insanity is one of the most common associated with psychopathy, but is actually a mental condition that prevents a person from understanding the nature or wrongfulness of their actions. Those who are insane have no understanding or control because they are out of touch with reality. Antisocial personality disorder is a chronic mental disorder characterized by persistent lack of disregard for the rights of others, violation of social norms, and a lack of remorse. Now, although antisocial personality disorder sounds like psychopathy, it does focus on behavior. ASPD is also a clinical diagnosis, unlike psychopathy, and ASPD may overlap greatly with psychopathy, but not all psychopaths have ASPD, but some do, which would not be surprising. Narcissistic personality disorder is a personality disorder involving a pervasive pattern of grandiosity, the need for admiration, and limited empathy. It typically begins in early adulthood and presents in a variety of contexts. Most psychopaths are narcissists, but narcissistic personality disorder does involve fragile self-esteem that is hidden by the grandiosity. Sociopathy is considered a form of antisocial personality disorder that includes traits similar to psychopathy. The key differences between sociopathy are one, that it isn't a clinical diagnosis. Sociopathy is also deeply rooted in environmental factors, and they also tend to be more emotionally reactive, and they are able to form attachments to a few people. Criminal psychopaths differ from other non-psychopathic criminals in several ways. These ways can include that criminal psychopaths are more likely to malinger, meaning faking their symptoms to manipulate the system. Psychopaths often malinger for strategic, self-serving reasons driven by their lack of responsibility and accountability. Psychopaths also exhibit criminal versatility, meaning they engage in a wide range of crimes rather than specializing in one type. Oftentimes, psychopaths have a widespread criminal background that can include murder, burglary, rape, and they typically just don't specialize in just one specific crime. Psychopaths also have a higher recidivism rate, meaning they are more likely to reoffend after release. Psychopaths have a higher rate because their traits and behaviors make them less motivated to change their behavior. Non-psychopathic criminal Non-psychopathic criminals experience guilt and fear the consequences, which can encourage better engagement with treatment and reduce offending again. Psychopaths are more prone to use violence compared to non-psychopathic criminals. Psychopaths have reduced fear and low empathy, which makes them more likely to use violence, and their thrill-seeking nature can drive them to use violence as a tool for control, intimidation, or even excitement. Psychopaths are difficult to treat due to their emotional detachment and manipulation skills. Criminal psychopaths have a special advantage due to their traits and characteristics. They oftentimes manipulate therapists, resist change, and fail to internalize lessons, unlike others who can engage with treatment by recognizing their mistakes or even feeling guilt. This results in a higher chance of continuing criminal behavior. Their charm and manipulative abilities often help them succeed in getting parole or favorable treatment within the justice system. Since they do lack empathy and remorse, oftentimes we struggle to find a meaning behind their violent crimes. And when we normally look at violent crimes, our first move is to look at close friends and family. But with psychopaths, oftentimes their crimes have no motive just besides their personal interest and their thrill-seeking nature. The manipulator's maze. Since we already know psychopaths differ from other non-psychopaths significantly, this presents many problems for society, but even more so for the justice system and clinicians. The main reason this presents problems for them is because their manipulativeness and superficial charm. Their superficial charm and confidence often help them gain the trust of clinicians, parole boards, or legal authorities, and this makes it easier for them to appear rehabilitated or non-threatening. Their tendency to lie, malinger, and downplay their behavior allows them to avoid consequences or gain advantages such as reduced sentences or favorable diagnoses. This makes accurate assessments and appropriate intervention incredibly difficult, increasing the risk of recidivism and undermining public safety. Boardrooms, bedrooms, and beyond. Although there is a negative association when we hear psychopath, there are those who are non-criminal psychopaths. These individuals still struggle with the traits of their disorder, but do function outside the justice system. Some psychopathic traits such as charm, fearlessness, and ruthless decision-making can be powerful assets in high-pressure environments like corporate leadership, or politics. These qualities can help individuals command attention, make bold strategic choices without being paralyzed by fear or emotion, and remain calm under intense scrutiny. If used in a positive or productive way, these traits can contribute to effective leadership, crisis management, and achieving challenging goals that others may shy away from. Psychopathy often leads to emotional exploitation and broken trust in relationships. Their inability to form genuine bonds results in manipulation and shallow connections, leaving family and friends confused, hurt, and emotionally exhausted. This pattern creates lasting dysfunction in both personal relationships and the community. Understanding psychopathy helps improve mental health treatments and criminal justice strategies with a focus not just on punishment, but on preventing harm before it escalates. Tailored interventions and better risk assessments help reduce reoffending and protect communities. Balancing treatment, public safety, and civil rights is tricky. How can we manage people with psychopathic traits, ethically without infringing on freedoms or ignoring rights. It requires fair, individualized assessments and transparent, evidence-based decisions that protect society while respecting rights. The focus should be on rehabilitation and prevention, continuously improving approaches to ensure both safety and fairness. Understanding psychopathy matters because it helps us develop better ways to prevent harm, improve treatment, and create fairer criminal justice policies. This knowledge allows us to address the root causes of harmful behavior rather than just punishing it, leading to safer communities and more effective support for individuals. And then these are my references. Thank you.